Welcome to the Voice of African Women. Today I'm going to give you some recommendation on health exams that women need to take, and I'll also give you a few recommendations on health exams for your husbands or your significant others. Regular checkups and physical exams are an important way to maintain good health. Many diseases, if caught early, can be cured and treated. Even if you're young and healthy, you still need to get regular exams. When you're in your 20s, you should have at least 2 physicals. One physical should include cholesterol. The other 2 physicals should include weight and height check. Blood pressure should be checked every year. Now for the women. I'm going to give you some general guidelines on screening procedures for healthy women. Your doctor may recommend a different screening schedule, and this could depend on your age, your personal health history, or your family medical history. One important test to make sure you take is a blood pressure test. You should have this test initially done at 18 years of age, and then every 1 to 2 years thereafter. If your blood pressure is high and it's not treated, this could result in a heart attack, a stroke, or even heart failure. Breast cancer exam is very important. Beginning at age 40, clinical breast exam and mammogram should be done every 1 to 2 years. After the age of 50, your doctor may recommend an annual mammogram. Cervical cancer is a disease that a lot of women are battling these days. Women need to get an annual pelvic exam and a pap smear starting at the age 20. Within 3 years of being sexually active, or at age 21, you should get a pelvic exam and a pap smear. The pelvic exam is an important part of your annual exam. This is a way in which your doctor checks your female organs to make sure that they are healthy. During the pelvic exam, a pap test is done as well. The pap test is for testing you for cervical cancer, and sometimes the doctor may do sexually transmitted disease screen depending on the symptoms that they may see during your exam. Nowadays they have a blood test for HPV. HPV is a human papillomavirus, which is the virus that causes cervical cancer. So when you go to your doctor for your exam, try to make sure that you can remind your doctor to get this done. Ladies, if you're sexually active, have never been to a gynecologist, I do recommend that you make an appointment because this is very, very important. Cholesterol is another test that's very important for you to take during your exam. Increased levels can cause a risk of heart attack and stroke, and it's recommended that every 5 years over the age of 20 you should get this tested. If the levels are abnormal, you need to get this done more frequently. Beginning at age 50, you should get a colon and rectal cancer screen done. Depending on the doctor's recommendations, this could be a fecal occult blood, which can be done yearly. It can be a flexible sigmoidoscopy, which can be done every 5 years, or a colonoscopy that can be done every 10 years. If you want to maintain a beautiful smile and make sure that your teeth are well and healthy, you should visit your dentist at least once a year. Diabetes is one disease that needs to be monitored very regularly. Every 3 years after the age of 45, you should get your blood sugar measured. Sometimes if you're at higher risk and you have symptoms, you should get your test done more frequently. Some of the symptoms of diabetes include excessive thirst, frequent urination, unexplained weight loss, fatigue or slow healing bruises and cuts. Your eye exam is important as well. Between the age of 20 and 39, you should have at least one time an eye exam. Every 2 to 4 years between the age of 40 and 64. After the age of 65, at least 1 to 2 years you should get your eye checked. Osteoporosis is very important. This is a disease that affects women, especially at an older age. And the test for this is called the bone density measurement. It's a very painless scan of your body, and the doctor can always give you more information on this. The routine screening for osteoporosis should start at about age of 60. Now, We are always worried about our weight, and weight is very important. You should get your weight and height checked because this tells you what your body mass index is. If you know your body mass index, it can tell you whether you're obese or whether you're overweight. You want to make sure you're not overweight because there are risks that are involved with being overweight. An example is a type 2 diabetes, or you can also have a high risk of having high blood pressure. Ladies, in order for you to stay healthy and stress-free, you have to make sure that your men are healthy as well. Some of the exams that you need to recommend to them are prostate cancer screening after the age of 50, and this includes either a digital rectal exam or a prostate-specific antigen. The men really hate the digital exam, so you may have to push them to get this done. Other exams include blood pressure, cholesterol, colon and rectal cancer, blood sugar for diabetes. They should get their weight and height checked. They also need to get a dental checkup every year and to get their eyes checked. Two important tests that I need to recommend for both men and women are sexually transmitted disease screening. This would include HIV, gonorrhea, genital herpes, and chlamydia. If there's somebody out there who's having sex without using condoms or have multiple partners, it is recommended that you get tested for these tests. When women are pregnant, the doctors usually do recommend to get this test done. The last test I'd recommend is a skin exam. Usually it's recommended beginning at age 20 that you get your skin tested to make sure that you don't have skin cancer or no risk for skin cancer. If you need some detailed information on the topic today, you can check the website for mayoclinic.com, cdc.gov, or WebMD. You're also always welcome to email us at africanwomen.com. Thank you for joining us today. Please stay healthy. Until next time, goodbye Africa, goodbye world.